Joining us now from London is Elinor Raikes, Vice President for Programme Delivery at the Global Relief Organisation, the International Rescue Committee. Thanks for speaking to France 24. I'm afraid we'll come back to her as it doesn't appear we... Are you there, Elinor?
I'm here. Can you hear me?
Yes, we can hear you. Fantastic. Okay. Thanks for joining us.
Great.
So first off, I know the IRC is suffering after US aid cuts, but do you still have teams on the ground? If so, what are you hearing from them?
Yeah, absolutely. We have a large team in Myanmar. We've been present in the country since 2008. And our teams are in Mandalay and the area working with our local partners. And yesterday we're able to actually begin responding to the immediate needs for people affected by the earthquake, providing food, clean water, non-food items, blankets, and so on. And that continues today and in the days to come. Obviously, this is a very significant crisis in a very complicated part of the world that was already experiencing a very significant humanitarian crisis. So we have a layered emergency on our hands with a lot of difficulties in how we respond to the growing needs by the day.
So for now, you're focusing on Mandalay, as I believe a lot of the relief is. But of course, further afield, we just simply don't know the extent of a lot of the damage because of the ongoing civil war.
Yeah, what we're hearing today from my teams, compared to what we were fearing yesterday, is that we do think most of the people affected are going to be in areas that we can access, that we can reach. It's going to be very complicated, as you can see in the images. Massive infrastructure damage, both directly in the epicenter area, but also transport links to get to these areas. That's going to be actually the major complicating factor. But we do have teams that are both in Sagaing and Mandalay, local partner organizations that have started work already. So we're feeling more optimistic today than yesterday in the ability for relief efforts to actually provide the assistance that's needed so desperately in these days and hours.
It's great to hear that optimism. Is that partly because of this unilateral ceasefire? Does that not come into it?
It's more about where the affected populations are located. But of course, a cease in hostilities is essential if we're going to be able to provide continuous care and access. All the people who have been affected by this earthquake. It's had a very wide impact, as you know, not only in Myanmar, but in Thailand. And so the geographic area is quite wide where people have been impacted. So, we've started our assessments and we're starting our immediate relief distributions in Mandalay and Sagaing. But, that needs to continue. We need to move out into the rural areas and assess the damage and the needs there too. We know already that hospitals in the cities are overwhelmed. That's no surprise when you look at what's happened. But we expect also, infrastructure to provide clean water, sanitation, health services in the rural areas as well as in the urban areas are going to be impacted. They were already overstretched before this earthquake hit due to the years of conflict and very significant numbers of displaced across the country. And so this is just adding strain to an already precarious situation.
And beyond those immediate needs, shelter, water, food, we're seeing pictures of great cultural and religious damage as well. Pagodas, temples, cultural sites collapsing. That surely can't be helping with the psychological aspect of what people are going through.
I think any earthquake of this scale has a very significant impact on mental health, well-being for communities. It's absolutely catastrophic what you're seeing, and the very sudden nature of an earthquake, and the damages to communities that are connected with one another. So as you see, we're immediate health needs, immediate basic needs, shelter, food, water, but the responding adequately to the impact of an earthquake like this. This is a work of months, not weeks, sometimes years, to really help rebuild literally and psychologically, I think, the impact on communities.
Now, we've been reading here that the latest estimates of fatalities are upwards 1,600. Do you have your own estimates of where this might go?
Well, what we know is likely to happen from many decades of responding to crises like this is that it will take more days, maybe weeks, to uncover the full extent of the death toll and the missing persons list. It will also take days and weeks to uncover and understand the impact on communities and population in the area. There are many people who are displaced, who are living with relatives, sheltering in different ways. At this stage, on day 3, it's not that visible, but that will become more visible in the days and weeks to come, and we'll be working with all other responders and local communities and local actors to really understand the nature of the needs and where the needs are greatest. The other thing that we know from decades of responding to crises like this is that it is the people who are already more vulnerable that are going to be more impacted by something like this. So, typically women and children, elderly, people that had pre-existing conditions. So as you look at a community-based response and look at providing immediate services, quite soon we pivot to really trying to understand how do we provide tailored services to help the most vulnerable in these communities.
Now, your charity said it had at least 39 funding awards terminated because of the axing of US aid, affecting potentially 2 million people across the world. How is this going to affect relief for Myanmar? And is it one of the worst things to happen to your charity since it was set up in the 1930s?
The impact of the US government funding changes have been very significant for us, for many organizations as well. We're working it through. In fact, we actually had a funding award in Myanmar that was suspended for a time, but is now, we hope, reinstated. And we hope that stays. Obviously, is given the scale of the crisis in Myanmar before the earthquake. Important to know, we publish a watch list every year that ranks countries based on our prediction for how much the humanitarian situation is going to deteriorate in the year to come, and Myanmar was number 3 on the list for 2025. So, earthquake aside, this is a very significant humanitarian crisis and continues to be severely underfunded, not just from the US government, from the entire aid community. The humanitarian response plan in Myanmar, 5 months into the year, is only 5% funded. So we have a big funding gap at a baseline before we even begin to think about how we respond to this earthquake.
So to be clear, for now, you're able to keep staff and contractors on, but if cuts do go ahead, then you might lose your ability to respond in places like Myanmar.
Yeah, at the moment in Myanmar, we have a full team responding to this crisis. We've been able to retain that capacity. That's what we hope to do in all of our, the countries where we work that have the most significant humanitarian need, that have the greatest number of populations that are at risk. We've been able to do that for the most part, despite the funding changes, which are challenging. And at this point, one of the biggest challenges is that we don't really know what's ahead still. So there's still a lot of uncertainty in terms of the US government funding. But we're in constant dialogue with them, and hope very much that funding for this situation in Myanmar will be forthcoming.
Elinor Raikes for the International Rescue Committee, thanks very much for speaking to France 24.
Thanks for having me.